Hi, my name is Nick. Today I'm going to be going over weaning parameters. Before we even start this procedure, we are going to check the patient's chart. We're going to walk in, introduce ourselves. I'm going to wash my hands with either soap for 15 seconds or I'm going to use hand sanitizer for at least 10 seconds, let them dry completely. Put on gloves. I'm going to ask for the patient's wristband to look at it, and then I ask for 2 patient identifiers. This is my vent. It's not currently set up, but we are going to still use it. There's 2 maneuvers that we're going to perform for weaning parameters. The first one is a vital capacity maneuver. This is where we'll have the patient breathe in to total lung capacity and then breathe out normally. We're going to take this value with either the vent, their total lung capacity, or we can also use a spirometer. The second maneuver that we're going to be doing is negative inspiratory force, also known as maximum inspiratory pressure. And what we're going to have the patient do is we're going to explain to them to breathe out all the way to residual volume. Then we are going to have them pull in as hard and as fast as they can against a negative inspiratory force. Now they need to hit at least 20 centimeters of water or more for them to pass. We're going to use either the vents or a unidirectional manometer. This is the most preferred method, much better than a static manometer. Once we get the values for both maneuvers, their vital capacity needs to be greater than 10 milliliters per kilogram. Their tidal volume needs to be greater than 5 milliliters per kilogram. They don't need to go over a minute ventilation of 10. It needs to be less than 10 liters per minute. And their frequency needs to be between 8 to 20 respirations. They need to fit the criteria for each of these to be passing. Once we do this maneuver with them, especially on the NIF, we have something that's called panic NIF. If the patient isn't able, we're not getting good NIF ratings, we can still perform it. It's not the preferred method, but sometimes we have to do this. Once we get our values, we're going to wash our hands. We're going to ask if the patient needs anything before we leave. We're going to wash our hands, leave, chart everything. And then we're going to suggest any changes. If the patient met all criteria, then they're going to be ready for weaning. If not, we may need to switch them to SIMV. We may need to change the frequency, the tidal volume, and then we're going to try this again probably in 24 hours. Now, if they have a drop in SpO2 below 90, we need to stop. If their frequency is above 35 for 5 minutes, we need to stop. If their blood pressure goes above 180 and above 90, systolic above 180, diastolic above 90, we need to stop. All of these are indicators of stopping the procedure entirely. From that point, we meet with the doctor, discuss any changes, and then we're good to go from there.